Welcome everyone to today's McMaster University's Continuing Education Caregiving Essentials webinar, Real Family Experiences Informing Policies to Support Canadian Caregivers Now. I would like to begin by acknowledging the land on which we reside. McMaster University recognizes and acknowledges that it is located on the traditional territories of the Mississauga and Haudenosaunee nations and within the lands protected by Dish with One Spoon Wampum Agreement. My name is Liv and I'll be your host on behalf of McMaster Continuing Education. Today I'm joined by our facilitators, Donna Thompson and James Gennaro, as well as Alana, our marketing specialist for technical support. Without further ado, I'd like to introduce you to Donna Thompson, who is the co-author of The Unexpected Journey of Caring, The Transformation from Loved One to Caregiver, and the author of The Four Walls of My Freedom, Lessons I've Learned from a Life of Caregiving. Donna is a patient and family advisor on health research and policy and teaches family caregivers in Canada how to advocate for care in the hospital and the community. She blogs regularly at the Caregiver's Living Room, and you can find her at www.donnathompson.com. Donna is also the facilitator of the Caregiving Essentials program and the Infection Prevention and Control for Caregivers and Families program at McMaster Continuing Education, and they are both free online courses for family caregivers. And I would like you to introduce to James Gennaro. James is a public policy and advocacy professional with over a decade of experience in politics, policy, and government relations. He began his career in the Ontario Public Service working on disability legislation. He then transitioned to the political policy space and served two successive Ontario ministers of community and social services as senior policy advisor on social assistance, poverty, and veterans issues. In 2014, James assumed a new role serving Premier Kathleen Wynne as her social policy advisor. In this position, he was responsible for a diverse array of policy areas, including poverty reduction, housing, the basic income pilot, disability issues, autism services, and municipal affairs. In 2018, James left the public sector for a role in the not-for-profit sector. He was the Director of Community Engagement and Policy at the Community Living Toronto from 2018 to 2022. In this role, James led an ambitious advocacy agenda focusing on housing, income security, and social improvement. He holds an honors BA in political science, history, and languages, and a master's in public policy from the University of Toronto. James lives in Toronto with his wife, dog, and two cats. And I'll hand things over to Donna now.
Thank you so much. I am really delighted to be having a conversation today with you, James, and we are going to do a deep dive into the policy work that you've been doing, which is a key driver, I think, in really transforming the lived experience for Canadian caregivers, all caregivers. So, James, I want to begin by asking you if you can tell us about yourself and what brought you personally to the Canadian Centre for Caregiving Excellence, and also a little bit about the Centre and its priorities, and where does policy transformation and change fit into those priorities?
Sure. First off, though, thank you, Donna, for the invitation to join this series. It's always nice to have a conversation with friends, and all the better when we can have a larger conversation with more friends online using technology that's been gifted to us. So thank you for the opportunity to talk to you today. Those of us who work in the caregiving policy space tend to stand on the shoulders of giants as we're doing this stuff. A lot of work has come before us. And Donna, you're certainly among those giants who've been pioneering in this area. So thank you for the chance today. And thank you also to the team at McMaster for facilitating this discussion and for putting it all together so we can be here today. I'll start by talking just a little bit about the Canadian Centre for Caregiving Excellence, and then I'll jump into my own way of entering this policy space. So we are a relatively new organization. We just launched back in May. So this coming May, in a few months, will be our 1 year anniversary, and we are powered by and sprung out of the Azrieli Foundation. The Azrieli Foundation is the largest non-corporate philanthropic foundation in Canada. They do great work across the country, both here in Canada as well as in Israel, around a few different large policy areas and areas of giving, a lot of healthcare, a lot of disability, and a lot of work in the arts as well. And when prior to COVID, they were doing a hard think about what are the next things that need to be addressed in Canada. There was a list prepared, a bunch of things that we would all know quite well were on them, but caregiving was on that list. And it was not at the top of the list, but it was near the top of the list. And then COVID hit. And suddenly our world changed across the board for everybody all over the world in different ways. If you were an essential worker going to work every day, your work didn't really change other than you were wearing a lot of PPE doing it, but you were still going to work every day. The main difference was you were the only one going to work, and your work suddenly became dangerous in a way that it wasn't before. And if you were what we call a care provider, a personal support worker, a developmental services worker, a care attendant, that sort of thing, you were doing your work while everybody else stayed home, and suddenly our society came to see you as an essential worker and put you in a different sort of category. We all remember banging our pots and pans at 7 o'clock every day for a while there, that sort of thing. So as COVID hit and the thinking behind, okay, who are caregivers? Who are caregivers? Who's doing this for a living? And who's doing this stuck at home with mom, dad, daughter, son, cousin, etc., doing this work from home suddenly without a larger support network behind them that they used to have because of all the impacts of COVID, etc. So in the sort of the heat of the moment, if you will, caregiving jumped to the top of the list as a thing that needed to be addressed. So the Azrieli Foundation stepped up and birthed the Canadian Center for Caregiving Excellence, sort of in the heat of the moment around COVID. And we do a bunch of different things. We fund great work. We do leadership development. We partner with organizations across the country to do research as well as programming and knowledge translation and knowledge mobilization. We're running, for example, an all-Canadian cohort of the leadership, the consortium on leadership coming out of the States to raise the capacity of leadership in the developmental services sector across the country. We're also funding some great work all over the country, in Nunavut, for example, in Quebec and in Francophone communities outside Quebec, and lots of other places. And then the piece of our work at CCCE that I'm responsible for is around advocacy, government relations, and public policy. Our first foray of which is our white paper, Giving Care, an approach to a better caregiving landscape, which we're here to talk about today. That's our organization. Donna, do you want me to just say a little bit, just briefly about me personally, and how I came to this space?
Yes, yeah,
Okay,
absolutely.
sure. So I've been some sort of caregiver my whole life. I grew up, I'm a son of Portuguese immigrants who came to Canada 50 years, actually, at the end of this month, 50 years ago at the end of this month. And my grandparents, with whom I'm very close, didn't really speak English. My grandmother, who's still with us, does not really speak English. So from a very young age, I was the translator. I was going to the medical appointments. I was going to the lawyer. I was going to the grocery store. I was doing all that sort of stuff with them. Even when they were younger and they needed help navigating Canadian stuff, they were so busy raising a large family and keeping the ship going that they never really needed to learn the language. So I was that for them for many years. And then as my grandfather got older, he received a pretty significant diagnosis of dementia and Alzheimer's, kidney disease, and a bunch of other stuff. And his health started to take a pretty precipitous decline about 8 years ago or so. So I stepped up in a more direct caregiver role around not just translating, but also booking and scheduling and transporting and stuff like that to medical appointments. And then in particular, in the last couple of years, my grandfather's health took an even more significant decline. He was bedridden for the last 2 years of his life, and he passed away just back over the summer. And I was very
Mm.
involved, particularly in the last bit of his care. Um, as his health declined and we had PSWs in and out of the house and coordinating, what does this specialist say? What does that specialist say? What's the palliative care plan, et cetera, et cetera, et cetera. And I was privileged to be part of that. And as I say, he passed away over the summer. And now that work never really ends. Even this morning, I was on the horn with the Portuguese consulate here in Toronto to finish wrapping up some stuff for his estate. And now I'm more involved in the care of my grandmother, who is a rock in my life and in the life of my whole extended family. But having spent so long as the primary caregiver for my grandfather in the home, because that was the family's decision to stay at home for as long as humanly possible and bring the care to him. Now that she has transitioned out of that role, her own various issues are starting to present as well. So I'm very involved in her care in that way as well. So lots of different approaches, different ways that I've been plugged into caregiving, and it's a privilege to be able to do it.
Oh gosh, what a story. I'm so sorry for the loss of your grandfather, James.
Thank you.
And I as one caregiver to another, I really admire your commitment to your family. And I think about the immigrant experience in Canada. Most of us all come from somewhere else, unless we happen to be Indigenous. But many of us, the anchors of our families are our grandparents, and we are, privileged to be able to care for them, as I cared for my grandfather and my mother and our son, and some of us are serial caregivers. I want to mention too that I have the great privilege of being an advisor on the advisory of the Canadian Centre for Caregiving Excellence. And it is a role, along with my role here at Caregiving Essentials at McMaster Continuing Education. My role as an advisor at CCCE is really something I'm so excited about, because, I think I speak for lots of us when I say that government programs might sort of come and go. And there might be one tiny promise that you think, oh, that's better than nothing. This organization went, and I encourage everybody to go onto the website, and James at the end is going to tell you how to do that and how to get involved with CCCE, because we're looking for passionate caregivers across the country. I really think that this is an opportunity for real change in how we as a nation support, recognize the civic contribution of caregivers, and support caregivers differently, better on a day-to-day basis. So first of all, I do want to talk about the white paper, James, and I want to ask you, the white paper is based on the premise that we in caregivers in Canada are in crisis. So how and why did that crisis occur? What is the nature of that crisis?
Yeah, that's an excellent question, Don. I'll just nod, before I get into that, I'll nod briefly to, as you say, your role in our advisory council, which we very much appreciate and value your insight, and also your role in getting this white paper together as one of our critical readers. We learned a lot, and we came to learn a lot in pulling this white paper together, and we couldn't have done it without you there, Donna. So thank you very much for that, and to all the other critical readers as well, a couple of which are on the call today, actually. So thank you for that. So how do we get here? That is sort of a multi-million-dollar question, isn't it? So I think about it like this. I feel as though in preparing this white paper and in being privileged to be part of the start of CCCE and getting this going as an organization, and I've said this to a couple of people now, I feel as though we have accidentally unearthed a ticking time bomb that has been there all along, but we haven't noticed. And the reality is that in different parts of the world, in Germany, in the UK, in Australia, even here in parts of Canada, there's a view of caregiving that it is a fact of life, it is a reality of life, it is an absolute necessity for society and the economy and for our countries to function. And ergo, it needs dedicated support and to be thought of as a specific thing that needs specific interventions.
Mm-hmm.
However, across Canada, that has not been the experience so far. Across Canada, caregiving, unfortunately, if thought of at all, is tended to be thought of as a secondary or tertiary consideration. There are many diagnoses I think we can apply to why that is. I would say part of it is, for example, the federalized nature of our system, where you've got a large federal government that does a lot of good things, and then 13 provincial and territorial governments who do a lot of good things, in part the administration and governance of our healthcare system. But it has led to a really complex series of supports and funding envelopes and transfers and programs and sunset programs and rebirth programs, et cetera, all of which come together to form our health system, which is one of the things that Canadians hold most dear about our country. But in doing that, hasn't really thought about what I've come to talk about as the other side of the equation or the other side of the gurney. You know, we get so caught up in administering the healthcare system, administering the social support system, that there isn't much, unfortunately, much thought about the other side. That's a simplistic, I think, story about how we got here. But the simple reality is, regardless of how we got here, we're here. Caregiving is in crisis across the country. We know this. We all experience this every day. I can give you a few numbers. For example, we know that we've got 7.8 million Canadians who are caregivers today. That's about 1 in 4 people across the country. At some point in their lives, 1 in 2 people will be a caregiver. So that's fully 50% of the population at some point will be a caregiver, which is a staggering number. It's, you know, a result of aging population and medical complexity changing, people living longer than ever before, which is a real blessing. And also something I think about a lot, and a bit of experience in this in my own family, that even people with intellectual disabilities and significant disabilities, for the first time in human history, are living to a ripe old age as well. This is it's fantastic that that's happening. It also means that medical complexity that exists when you're 20 just gets more complex when you get to 60, 70, and beyond. So all of that sort of comes together to say that the need of caregivers is going from the reality of caregivers, is going from 1 in 4 to 1 in 2. Meanwhile, we all know intuitively, and we now know concretely, that the toll of on caregivers is also quite significant. 87% of caregivers report experiencing loneliness, for example, which is a new, relatively ununderstood public health concern. Loneliness in some circles is being thought of as the equivalent to smoking 2 packs of cigarettes a day for the impact that it has on your physical health. Beyond that, over 67% of caregivers report an impact on their mental health, as well as feeling isolated, that a consequent impact on their mental health. And lastly, over half say that their physical health has deteriorated over time as a result of being a caregiver. So if you think about putting all that together, 1 in 4 today, about to become 1 in 2 at some point over their lives, and the impact that has, we just talked about with those numbers I gave you, all of that culminates together into the simple fact that caregivers are in crisis. They're feeling the impact every day, and we need them now more than ever, and that need will only grow as time goes on.
Yeah, you know, the thoughts in my head are, as you're describing this situation, we've moved from what is, as thought of, most people think of caregiving as a personal crisis, but it has become a national crisis, a public national crisis. And the other thought that occurs to me as you're speaking is this idea that I think it was Anne-Marie Slaughter, an academic in the United States, who coined the phrase that care is the work that makes all other work possible. So if you really begin to think about the work that we as family caregivers do as infrastructure for the integrity of the society that we live in and that enables people to be employed, then it makes sense that, as you say, James, caregiving is the next national policy frontier. We want people to be able to step up to this role without risking losing everything in their lives, right? So, I'm wondering if you can talk a little bit about, in the policy white paper, there's a lot about financial stability and what you lose in taking on caregiving. And there are some really solid solutions being proposed in the white paper. And I wonder if you can tell us about that. And I ask that question as someone who was delivering kind of ridiculous levels of care for 23 years at home, very, very little sleep, etc. And it was impossible for me to be employed most of my adult life outside of my home. So I would love for you to talk about that financial piece.
Sure. No, absolutely. And I'll say that in and of itself is a twofold equation. So on the one side of the equation, let's think sort of a little bit positively about what is the potential that we're leaving on the table today for lack of an appropriately structured and resourced caregiver support system. It's a tough calculation to do, but we're basically leaving almost $1.5 billion of productivity on the table across the entirety of the Canadian economy because people need to make very tough decisions about working and not working when they are called upon to be a caregiver. For example, almost everybody in the Canadian population works. We know that, that's not a surprise to anybody, but over 50% of caregivers report having to take time off work in order to do their caregiving work. So that means that half of us, so if you think about 1 in 4, half of that 1 in 4 is now have had to make some sort of very tough calculation in their own lives to basically leave money on the table, to not work to their maximum economic capacity, and take the consequences of that because they are called upon to be a caregiver for somebody in their life. That's a lot, and that leads to some pretty significant financial distress among caregivers. The number of caregivers out there who report experiencing financial distress or having to mortgage a house or take on significant debt in order to both support or to sort of take the time to do the caregiving work themselves, but far too often also financially, as well as in a caregiving way, support the person that they're caregiving for. Those numbers are astronomical across the country, and it happens every day. So this is an area where we need urgent, critical reform. It should not be that you as a caregiver are doing society's important work to look after somebody in your life, and you are also worrying about paying your rent and putting food on the table, in addition to worrying about putting food on the table for the person you're looking after. So we think about this in a few different ways. The first is we got to consider putting money in people's pockets while they're being a caregiver. Parts of the world already do this. The UK, of course, is the gold standard for how to do this with a caregiving benefit, where by simple virtue of being a caregiver for somebody over a certain hourly threshold, I think it's about 20 hours or so a week in the UK. This also happens in Australia. If you find yourself in that situation, then His Majesty's government will provide you with a monthly stipend so that you can keep doing what you're doing and not worry as much about the basics of life. Now, I'm not going to say it's the most generous program in the world. It's not. It's in the order of, I think, about £400 a month, which translates to these days about 550 or so dollars a month, maybe 600. That's not, that's not a mortgage payment. That's not a rent bill even, or monthly rent for most people in Canada, but it is on the margins a little bit to make it a little bit easier for you to keep doing what you're doing, and again reduce your overall stress level so you're not worrying as much about finances. That's one approach. Another approach is we already have across the country a basket of tax credits, most of which are non-refundable, which means that these tax credits reduce your overall tax take at the end of the year rather than returning money to you at the end of when you file your taxes. We have a pretty significant network of them, the Canada Caregiving Credit being one, of course, but there are others. And provincial credits as well. We're putting out in the window there that maybe it's time to think about all of these together as a basket and converting them from non-refundable to refundable credits, which means that you file your taxes, you do your paperwork, etc. Rather than reducing the tax take, it actually increases your overall return, your tax return that you get back from the Treasury once you file your taxes. That is a convenient, tried and tested way of putting money in people's pockets. You can structure it in such a way that maybe it's monthly or quarterly or twice a year, etc., so that you spread it out over the course of the tax year. But we already have these things on the table. What we're saying is, why not flip them and make it easier for caregivers to access them, make them more accessible, but also make them refundable so you actually put more money in people's pockets. That's just on the income support side. Of course, we could also have a conversation about the supports that care recipients themselves receive for their income, like the Ontario Disability Support Program here in Ontario, and there's a similar program in every province and territory across the country, as well as the forthcoming Canada Disability Benefit, which, God willing, the legislation will be passed pretty early in the new year when Parliament resumes at the end of January, and hopefully, don't quote me on this, but hopefully even get the regulations out and money flowing by the end of the year as well. So that's on the money side and how we can put money in people's pockets to do this work.
Yeah. It's interesting to me to think about how the founders, Naomi Azrieli and the Azrieli Foundation, decided to approach the experience of Canadian family caregivers and really put their energy and power solutions nationally to this crisis. And one thing I love about this organization so much is that the needs of the frontline healthcare workers are like this. So we need to support and transform the financial limitations that currently exist on their work. We need to make the experiences of paid caregivers as good as our experience, because we are in this together. So when I think about how does this white paper and how does your policy work translate to day-to-day lived experience of Canadian caregivers, how do these policy proposals in the paper make it easier for us to access paid help? So I've heard you say one thing already. If we have more money in our pockets, we have more money to potentially pay for more help to reduce the burden of care on ourselves. So that's one thing. And another, so can you tell me more about that, the wraparound solutions that affect everybody's daily lives who are involved in caring for someone?
Sure, and this is actually I think, and we like to think it's a unique angle to our work at CCCE, which is we intentionally, from the very beginning and in everything we do, we bring together three categories: caregivers, people who are unpaid, family, chosen family, etc. Obviously, care recipients, people with disabilities, seniors, etc., who are center in everything we do, but also what we call care providers, which is to say people who do this for a living: PSWs, DSWs, again, care attendants, lots of other categories of people who do this for a living across the country. So we purposely and intentionally knit together all three when we're doing this work, because they are all, it's a three-legged stool. You know, you need all three to be functioning, and functioning in a sustainable way, in order for our country to function, and for our economy to work, and for us to stay sane as a population. So it all comes together like that. It would be remiss of me not to mention right off the bat that the number one issue for among care providers, and the thing that makes the most difference, is the fact that they are just so poorly paid. You know, there's no way around that reality. They're just, it is, if you think about the lived reality of, say, developmental services worker, so somebody who works to support adults with intellectual disabilities, say in a group home or in a day program, that sort of thing. If you think about it, they are making, in most cases, not all, but in most cases, they are earning marginally more doing that kind of work than they would be working, say, in a coffee shop or at a restaurant, or doing retail work,
Yeah.
while taking significantly more risks, while taking a significantly higher toll on their emotional and physical well-being, and frankly, with fewer possibilities for career advancement and working their way up a ladder, right? Because it is increasingly difficult for somebody doing that frontline work to turn it from a job into a career, to work their way up within an organization or even within a sector, to go from frontline work to management, senior management, executive, etc., and earn more along the way. So you got to start with wages. There's no way around that. The wages need to be better, and commensurate with that is that the work conditions also need to be better. Far too many of these workers, who, by the way, are predominantly women and predominantly racialized women. Lots and lots of newcomers in this space, including, I would say, 80% of the many PSWs who were in and out of my grandfather's life in the last couple of years of his life, when he was receiving a lot of that sort of support. Easily 80% had arrived in Canada within the last year, just anecdotally, in having my own conversations with them. So that's a sidebar, but relevant, I think. The work conditions need to be better. For example, they should, just by virtue of doing this work, you should be able to have a stable income with stable hours. You should be paid for your transit time. So it's not this piecemeal sort of, you're paid for supporting James and then you're paid for supporting Donna, but you're not paid for the time between going from James's house to Donna's house, which can be across the city, for example, here in Toronto. So that needs to be a reality. Also, the fact that far too many of these workers are part-time workers, many or some because they want to be, but often because that's the only job that's available. So part-time work, meaning there are no benefits, there's no retirement security, there's no access to training and other things beyond the bare minimum that you need to do your work. That's all comes together to create a work environment that is precarious and unsafe often, as well as being underpaid and underappreciated. So you put all of that together, there are things we can do: pay them better, employ them better, make their wages more stable, and offer them the benefits and retirement type of savings arrangements that so many of us across the rest of the economy get, and aren't doing that tough frontline, physically and emotionally demanding work as a career. Then the last thing I'll say on this is that you need to recognize the fact, as I said earlier, that there's a lot of racism, unfortunately, that happens, and a lot of sexism that happens within.
That was brought up in the chat as well.
I just saw that, yeah. Within this workforce, you need to address that head on. I personally do not have the solution to that, but lots of people do and have done good thinking on, you know, what do you do if the person you're caring for has significant dementia and maybe starts to utter things that are unacceptable to the rest of us? Well, the basic thing you can do is support the person doing the work and make sure that they are okay. Create the conditions around them so that they are supported. They have access to counseling and support and other things. Not because that behavior is okay, but unfortunately because that behavior happens a lot every day, and you need to meet that challenge head on. And on the other side of the equation as well, a lot of these folks are, as I said, newcomers. They're themselves going through a very tough immigration process. Maybe they're temporary foreign workers. Maybe they're here as refugees. You know, that happens far too often as well. People come as refugees. This is the first job that they can get, so they take this job and cherish it for as long as they can. Why not support them in that immigration journey as well? Make it easier for them to become Canadian citizens, to join the Canadian family fully and stay in Canada. And if you couple making their lives easier through their immigration journey with making their lives better as a job and at their workplace, maybe, just maybe, these amazing people who do this amazing work that so many of us rely on, maybe, as I say, they will turn it from a job into a career and stay in it in the long term, which is ultimately better for both the families of the people receiving care who are around the care recipient, as well, of course, as the person receiving care in the middle of it.
I think it is interesting to think about the role of money, but it's also interesting to think about how the ways and means that we can make people feel welcome and valued. Because I mean, that's really important. And we need to do that, as you said, for our frontline workers too, because we're working in partnership with them. This is a job as diseases progress, as you know, in your grandfather's situation, James, where we cannot do this alone. We cannot do it alone. It is a team effort. And I think the last statistic I heard in the Greater Toronto area, 30% of paid shifts, funded shifts by Ontario Home Care cannot be filled because there's no staff. I sort of think that that's a very low estimate on the number of shifts that are going unstaffed. But even if you can get staff, you might be in a situation where you get somebody different coming through every day. So many people that I know said, oh, it's too much trouble to train a new person every day. So I'm just going to say no to all that help. These are the situations that Canadian caregivers are faced with every day. And I wonder if you can tell us, James, I mean, I know that you believe in the power of a national caregiver strategy, but what is it exactly, and how is it going to change these realities?
Yeah, great question, Donna. Before I tackle that, I just want to tell one very, I think, funny little reality story. Thinking about just parking, for example. So, as I said, near the end of my grandfather's life, we had, I think, at one point, 10 people coming out of his house on every day. You know, different PSWs, nurses, wound care, that sort of thing. You know. And my grandparents, their house, lovely house, the house they bought when they came to Canada, again, almost 50 years ago, is in the west end of Toronto with notoriously bad parking. It's just a reality of living in a big city. So there was one person in particular, her name was Helda, who I got to know quite well. For some reason, every time she came to my grandfather's house, she'd get a parking ticket. And she got so frustrated, and she thought, geez, like, I'm here doing my job. Also, I learned that the agency, the not-for-profit agency that she was affiliated with, didn't pay her parking tickets either. So this was like an out-of-pocket expense. But the alternative is she would have to park much further away in order to, you know, for paid parking to do her job. So my grandparents said to her, you know what? park wherever you park, give us the ticket, we'll take care of it. You never have to think about it again. And it became like a running joke. I would visit my grandparents more or less every other day. They would hand me the latest stack of parking tickets. And then it would be one of the wonkier roles that I took on was going on the City of Toronto website and paying these parking tickets for these amazing people who are coming and going. And we were able to do this because my grandparents were financially fine. You know, I can't, I think about this often. Had they not been, this would have been a very difficult journey, a much more difficult journey. And little things like that to make life easier for the people coming in and out, as well as the rest of us, would not have been possible. So, you know, it's a small story just to point to a bigger problem here. And you ask, why a national strategy and what does that do on the ground? I think about this a lot. And one way I come across this or come to this is there's a lot of work that goes on across the federal government and across provincial governments that abut the issue of caregiving. And I say abut not to say that they're tangential or they're not related, but rather they're not caregiving specific. You know, aging strategies, dementia strategies, diabetes strategies, mental health, addictions, housing, the list goes on and on. You know, lots and lots of important areas of government work that address, as I alluded to earlier, one side of the gurney or one side of the equation. But the reality is, if you're talking about aging, if you're talking about disability, if you're talking about mental health, more often than not, there's the other side of the gurney, which is the caregiver doing caregiving work, be it a caregiver, family friend, etc., and or often both care providers doing this for a living. So as work is going on in these different areas over here, which are all important and necessary and should be supported, a national strategy helps us wrap our arms around all of that and think about the caregiver on the other side of the equation. The other simple reality, maybe not so simple, but I think this is true, and the evidence bears this out a fair bit. There are a lot of common needs for caregivers, regardless of how they came to be a caregiver or what sort of caregiving they're doing. You know, a kid with a disability who needs a little bit of support, all the way up to, again, thinking about my family's case, more or less 24-hour care, dementia support, medical intervention, that sort of thing for seniors. Obviously, the situation changes, it ebbs and flows, needs come and go, but there are a lot of commonalities there. So if we're thinking about mental health, addiction, housing, et cetera, et cetera, et cetera, and at the end of the day, it's the caregiver on the other side of the gurney doing that work, why not bring all of this together? Because those needs are so similar. And if we don't do it now, and if we don't do it in a holistic way, involving all of these different groups, we end up either missing the mark completely, and we miss that other side of the gurney, which leads to worse outcomes, worse mental health outcomes, more emergency room visits, more consequential diseases and diagnoses later on, et cetera. Or we end up living with the status quo, which is also unsustainable for all the reasons we already discussed. So we need this strategy, as I say, to wrap our arms around all of this and make real tactical, tangible differences on the ground. Maybe it includes hospital parking. Maybe it includes access to income supports. Maybe it includes access to mental health supports and wellness supports and things like that. That's the work that needs to come while we figure out exactly what's in and what's out. But as a starting premise, we need the strategy to think about all of this together and to make real world reform on the ground for people who need this the support today, not tomorrow.
Mm-hmm. What would you say, James, to people who might say to you, people, you know, on the Hill, people that you're lobbying to for this national strategy? What would you say to people who would say, you know, family caregiving is private and it should be private. It is something that is intensely personal, and it's never going to be, there's never going to be one answer that's going to help everybody, because everybody's care caregiving experience is so particular, so different, so informed by context, by culture, by all of these factors that make us all individual and present us with individual challenges. How would you go about answering that question?
Yeah, I'll say, in the scores of meetings that I've had so far with elected officials at all parties, federal and provincial as well, but across all party lines, um, for often I'm first met with sort of a cocked head or like a question mark dangling over their forehead, etc., as they try to grapple with what I'm talking about. But before too long, 9 out of 10 times they get it when they think about, oh, that's me, or that's my mom, or that's my neighbor, or my cousin, or my sister, or my friend, or my staff member. The reality of this 1 in 4 statistic is that it's also 1 in 4 elected officials. It's also 1 in 4 staff who work for elected officials. The prevalence of caregiving in Canada is so big and growing that it starts to present itself even at the level of our elected officials. And once you get through that door, you can see that puzzle piece click into place, and they know what I'm talking about, because it's not James abstract in a suit talking about what caregiving is, but rather son, daughter, friend, neighbor, mother, wife, etc.
Yeah.
So that's the first thing I'll say. It is out there even at the level of elected officials. Once you get to that next conversation, though, I find that a lot of people accept and believe that there is a role for society, read government, to support people in doing this work. As you say, Donna, this tends to be private. There's a stigma that still exists attached to a lot of caregiving work out there too, where people don't want to talk about it in the workplace because it's their personal life, or it's the reason why they had to take that vacation day was not because they were going to a cottage for a long weekend, but because they had to take their mom to the MRI or something like that. So it's there, intensely private, but so are lots of areas of our lives. Healthcare is intensely private. Our taxes are intensely private. How much we earn and pay every day is all intensely private. But we accept that there's a role for government in making this stuff easier and better and more sustainable. So we're not saying that every caregiver's life is the same and the solution needs to be the same for every person. Rather, what we're saying is, just like all of these areas of our lives where there's nuance and flexibility and adaptation and change, the policy solutions that are so desperately required need to also be adaptable and flexible and reflect that reality that not everybody needs the same basket of services or supports. But our obligation to caregivers doing this work is to make that offer, have that basket ready so that when they turn up, we can hand them the granola bar, the metaphorical granola bar, the metaphorical bag of nuts, the metaphorical bag or bottle of water, whatever they happen to need in that moment to do their work and to keep doing that work in the long term.
That's a great answer. I love that answer. But it also brings to mind the power of many voices behind this initiative and this effort to transform the care experience in Canada. And James, I wonder if you can tell us, and if it's possible to go to the next slide, that would be great, because there is a QR code that you'll be able to see and capture with your phone that will lead you to the Canadian Caregiving, the Center of Caregiving Excellence website. It'll take you right there. There we go. So tell us, I'm involved in this effort, and I am passionate about bringing as many caregiver voices to this national effort to transform our lives. And I'm very optimistic that we can do it, but we cannot do it alone. So James, can you tell us, how can people get involved, and what does involvement look like?
Yeah, and as you say, Donna, the power of many voices is what we're striving for here. There's no substitute for that, nor should there be. Um, Numbers matter, and lived experience matter, and matters, and individual stories matter in a very big way to getting this done. I always say caregiving is the next frontier of public policy in Canada. We don't get to cross that frontier unless we all come together and push and make a real concerted effort to get there and drive this story forward among people who need to listen and do something about this. The easiest thing to do would be for everybody to take their phones and scan this QR code that's on your screen right now. It takes you directly to our newsletter sign up at the Canadian Centre for Caregiving Excellence website. So you put in your basic details there, your name, your email, etc. Excuse me, and you can sign up for our newsletter, which you get every couple of months from us with the latest and greatest of what's going on. It also gives you the opportunity to join what we call Caregivers Can, which is our Caregivers Canadian Advisory Network. This is a group of people, mostly caregivers, but also researchers, people who with the more academic or policy interest rather than a personal interest in caregiving, who also want to be part of this in a slightly bigger way. They want to join us for the meetings with elected officials. They want to participate in discussion groups or be part of consultations. Looking ahead, many of them also want to be involved in our National Caregiving Summit, which we're going to do and run in November, which I invite everybody on the call to join. More information coming shortly, which you'll see once you join our newsletter. So please scan that with your phone, join our newsletter. If you're interested, join Caregivers Can as well. And in addition to all of that, follow us on social media. We're on all the channels, Facebook, Twitter, Instagram, LinkedIn, etc. Find us, follow us, and you'll love the stuff you hear, I hope.
Yes, thank you. You know, just before we go, I also just wanted to make a plug for Caregiving Essentials for McMaster Continuing Education and the commitment that this department has shown to family caregivers by offering free courses and training to all Canadian caregivers who are interested in upskilling and easing the burden of care through increased knowledge and training. And there are a number of initiatives in this respect across the country. And this is one of the really excellent ones. So thank you to Dr. Lorraine Carter, who's head of continuing education, who's with us here today. And I'd just like to thank you, James, and everyone at the Canadian Centre for Caregiving Excellence so much. I hope that everyone who listened today who is interested in taking an ambassador role, a leadership role, or a participation role in bringing this agenda forward, that you do get in touch with James and everyone at the CCCE, because all voices are important and welcome. So thank you, James. And I hand it back to Elena and team.
Thank you, Donna.
Thank you.
Hi, everyone. Thank you so much for joining the webinar today. Thank you, Donna and James. This was fantastic. Thank you, everyone. And I hope everyone has a great rest of their day.